Hi, my name is Kayla Natalie and I'm a certified birth doula. Let's talk about fundal massages and fundal checks. So after birth, we want to make sure that your uterus is still contracting. Yes, you heard me right. Your uterus does have contractions after birth. And this is for a few different things. This is to, one, get your uterus to go back down to its normal size. Its normal size is the size of your fist, and that goes inside of your pelvis. During pregnancy, your uterus grows to 1,000 times its normal size. So we want to make sure that it gets back down to its normal size. But it not only does that, but it also stops bleeding as well. After you give birth, your uterus does bleed because it is shedding all of that stuff that was in there for 9-10 months. And it's normal to bleed for up to 6 weeks after birth. I'm actually going to do an entirely different video about the different kinds of blood that will come out after birth. But in order for your uterus to stop bleeding and to not hemorrhage, your uterus has contractions, but sometimes it's not doing it properly, sometimes it's not doing it enough, and sometimes it just stops altogether. Sometimes it says, I'm tired, I'm done, I did my job, I'm done, I'm taking a nap. And it cannot take a nap. So if it does stop clamping down, if it stops contracting, your nurse will go in, check your fundus, that is the top of your uterus. And if it is boggy and not like firm, boggy means kind of like jello-y, like just, that was weird. Then they do what is called a fundal massage. Yes, it needs a different name because it's not a massage. Your nurse will take their hands on the top of your stomach and try to make your uterus clamp down. It's important to remember that the uterus is a muscle. So you're essentially trying to make that muscle cramp. And it's not fun. It is essentially kneading your uterus like dough. And trust me when I tell you, your nurse doesn't want to do it either. They don't want to hurt you in that way. Now let's talk about fundal checks. So that was the fundal massage. This is just checking to see if your fundus, if the top of your uterus is firm. So they will go at the top of your uterus, make sure that like it is cramping up, make sure that it's doing what it needs to properly. Now I will say some nurses are more aggressive with their fundal checks, and they can sometimes hurt too. But if it does hurt, you can tell your nurse to stop, especially if there's nothing actively going on. As someone that has had a postpartum hemorrhage, I hemorrhaged for nearly 2 minutes. They were doing a fundal massage on me for nearly 2 minutes. Here's the thing with fundal massages. They're not fun. They're not fun, okay? They do, however, save lives. I am one of them. Also, if you are hemorrhaging, they do have what is called a